Hello, my name is Dr. Daniel Hernandez. I'm the Director of Medical Affairs and Hispanic Outreach for Global Healthy Living Foundation, and thank you for listening in to this webinar. I want to share with you today a walkthrough of a patient's guide to understanding rheumatoid arthritis pain, which is a guide that was created and can be found on our CreakyJoints website. All right. It can also be accessed through the link awareness.creakyjoints.org/RA-pain. And this guide addresses all of these important points. And the reason why we've created this guide is because as we continue to understand how to best treat RA, the more we see that the better the communication between a patient and their healthcare provider, the easier it is to treat the underlying causes and therefore the better quality of life. It's also very important to know when pain might be due to something other than inflammation due to your RA condition, and when treatment changes may be necessary to address pain. We've seen that knowing the common causes of pain in RA, and when you have pain, knowing how to better communicate with your doctor about this pain, including during telehealth visits, is a huge help in knowing whether your treatment is working properly or if it has nothing to do with your RA treatment and it is something entirely different. That's very, very important. Okay, so to get started, it's important to understand what rheumatoid arthritis actually is first. And according to the National Institute of Health, rheumatoid arthritis, or RA, is classified as an autoimmune disease that usually results from a combination of genetic and environmental factors, many of which are still unknown. And we also have a different definition. In other terms, rheumatoid arthritis is a musculoskeletal disease that starts with inflammation of the joints and flows throughout your body. And the reason why we say it that way is that we always like to dive a bit deeper and explain why it's actually called rheumatoid arthritis. So what's in the word rheumatoid arthritis? So rheumatoid, it actually comes from rheumatism, which means a musculoskeletal disease. These are diseases that affect your musculoskeletal system, such as muscles, bones, and joints. And the word also, the word rheum comes from the Greek word for rhine, which means flow. This is because of how the disease flows throughout your body. And arthritis, it originates from the Greek word arthron, which means joint, and the suffix itis means inflammation. Therefore, rheumatoid arthritis is a musculoskeletal disease that starts with inflammation of the joints and it flows throughout your body. All right, so before we start talking about RA, or rheumatoid arthritis, let's take a look at a healthy joint. Normally, you have two bones and two articular cartilages at the end of these bones, which act like a protective cushion. This is an example of a synovial joint. I'm sure many of you have heard of synovial joints, and these are the largest number of joints in our bodies. And those are initially what RA affects, these synovial joints. These joints connect two bones with a fibrous joint capsule. And some examples of these joints are knees, elbows, and wrists. The fibrous capsule is lined with a membrane, which is called a synovial membrane. And this has cells that produce a fluid which removes debris. It helps lubricate the joints to move freely with fluid called synovial fluid. And this also has blood vessels running through it. And as RA's name implies, it attacks the body and causes these areas to get inflamed and destroyed. And usually it's destroyed in a symmetrical pattern, which means usually both sides at the same time. This is seen by the cartilage getting degraded, swollen, inflamed synovial membrane, as you can see in the picture, bone erosion. And this happens continuously And because of this chronic inflammation, new blood vessels actually grow, and it makes this an even worse process, as well as it helps spread it to other parts of our body. That's why within rheumatoid arthritis, as you remember, that word also means to flow, right, Ryan? Now, inflammation usually isn't a bad thing. Inflammation is usually good because it protects against infection and injury. Acute inflammation happens all the time. It occurs when you sprain your ankle or you get a paper cut. It's part of the immune system's box of tricks to spark a defense and promote healing. When a healthy person gets an infection, that person's immune system notices it. It uses T and B cells to fight this infection. It also uses proteins called cytokines that help recruit other parts of your immune system to fight the infection. And these are the JAK-STAT pathways and others, and this increases inflammation in the body. And once the infection is fought and beaten, everything goes back to normal. Now, let's spend a little bit of time talking about cytokines, which I just previously mentioned, because these play a special role in rheumatoid arthritis. Cytokines are proteins that coordinate immune responses. Basically, these are activated by the immune system in your body. There are many different types of cytokines that are part of this, but the ones that are thought to be the most important in increasing inflammation in your joints are these. Here is something you might recognize because of the medications you're most likely taking. Fight these cytokines, right, in RA. IL-1 beta, these increase inflammation and destroys bone as well as many other things. TNF alpha, this also increases inflammation and it actually increases the creation of new blood vessels, which increase the circulation of other inflammation cells. And IL-6, this is another cytokine that increases inflammation. It's produced by B and T cells as well as in the synovial fluid itself. So it's present quite substantially. It also plays a crucial role in the other features of RA, such as fatigue and reduced ability to think. So this is one of the reasons for brain fog that happens in many of our community. Now back to the gears. According to the most recent research and the ones currently being conducted, there are many ways that a person can get this autoimmune response. But the general idea is that there is inflammation in our bodies that is persistent and causes damage. Since this response is constantly triggered, over time, it damages the body instead of healing it. In RA, this immune response doesn't stop. It just keeps going. Our body keeps getting inflammation and creates this destruction and pain in our body. Unfortunately, sometimes the extent of this inflammation isn't as obvious to us, and it silently destroys our joints. That is why it's very important to treat this as soon as possible. Now, how do we treat this? We have to put a wrench in the works, and these are called DMARDs, this wrench. These are disease-modifying anti-rheumatic drugs. Within this category, there's different types of DMARDs. There's conventional DMARDs, biologic and biosimilar DMARDs, and targeted synthetic DMARDs. And what do these DMARDs do? These suppress the immune system's functions in different ways, depending on the DMARD. It slows down the disease's progression. It prevents further bone and cartilage damage in the joints. It's usually taken early and aggressively. It's taken long-term, and it can help patients achieve remission. But they are slow-acting, so they usually take several weeks to take effect. So it's important to be patient while starting a DMARD treatment. Now, now that we know what RA is, how it causes pain in our bodies, and what are the treatments for RA, it's important to see whether the pain we are currently feeling is caused by RA or if it's being caused by something else. Within our guide, we have created simple to read infographics that can help you differentiate between pain that is caused by RA and pain that is caused by something else. If you have been working with your rheumatologist or your healthcare provider and see that you have your RA under control and you're still experiencing pain, it could be due to something else rather than RA. So let's say that you're experiencing pain in your hand. It's important to see if this pain isn't caused by a co-occurring condition such as osteoarthritis pain. The difference between this and rheumatoid arthritis pain is that osteoarthritis pain is usually seen on one side instead of symmetrically as in rheumatoid arthritis. It also can affect different joints, such as the base of the thumb. It's usually sometimes seen at the base of the thumb, or the tip of the fingers, which are also called distal interphalangeal joints. So that could be a reason why you're having pain in your hand. Fibromyalgia. It could be caused by fibromyalgia, which is this is a condition that it's usually pain that is widespread and all over pain, right? So there's usually no swelling in the joints with this, but you're experiencing this pain. It could be caused by carpal tunnel syndrome. This is caused by a compression in the nerve that causes a numbness, tingling, and pain that can shoot from the wrist to the fingertips. There's also a pain that only usually occurs in one hand at a time. So remember how we said that rheumatoid arthritis usually happens symmetrically on both sides. If it's not happening on both sides, then more than likely it could be a cause of a co-occurring condition, and that's something to keep in mind while speaking to your rheumatologist or healthcare provider. So throughout the guide, we show you different common co-occurring conditions and give you an in-depth explanation in order to prepare you for a better conversation with your healthcare provider or your rheumatologist about these. And a final topic that I'd like to I'd like to go over is how to describe your pain and when to contact your doctor about your RA pain. So communicating your RA pain clearly and honestly with your rheumatologist or healthcare provider can make sure you get the care you need to manage and minimize your pain. To prepare for this guide, we asked top rheumatologists in the US what they wanted to know when it comes to helping patients manage their RA pain. In the guide, we provide a handy checklist that you can keep nearby during your next telehealth visit or bring it with you to your next in-person visit. And the points that are important to keep in mind are these, especially when you're talking about pain. So the first one is location. So where is your pain? The first thing your rheumatologist wants to know is the exact location of your pain. Is it on one or both sides of your body, like I just explained the reason behind that? Is it widespread beyond just the joints? Don't worry if you don't know the exact name of the joints. Just point to them and trace the path if the pain travels to other parts of your body. The other thing is scale, right? What is your personal pain scale? Your rheumatologist will likely ask you to describe your pain's intensity on a scale from 0 to 10. But because many people with chronic pain have different perceptions of pain than people without pain, it's important to put this in the context of your personal threshold for pain. So, for example, can you more or less function normally during a 3? Does a 6 make your reach for extra medications? So remember that your own pain scale can be very telling, especially as it's tracked over time. And remember, if you've been on effective rheumatoid arthritis medication, these DMARDs, and your pain score continues to be high, on 8, 9, or 10, it can mean that something else is driving this pain, right? The other thing is interference. Is pain interfering with your daily living? That's very important to keep in mind when communicating pain. You'll need to communicate the functional impact of the pain that the pain is having on your day-to-day life or your daily activities of living. For example, think about whether you're able to do the following. If you're able to get out of bed, dress, bathe, go to work, exercise, shop and prepare meals, do dishes, climb stairs. You're able to sleep. So if your pain is interfering with these, it's very important to address it in your next visit. The other thing is feeling. So how does the pain feel to you? There's no one right word to perfectly describe your pain, but using language to convey your physical sensations can help your doctor identify the cause of your pain. So for inflammatory pain, like that from RA, the words that are used commonly are throbbing, aching, sharp, shooting, hot, grating, dull, or you might opt for a more detailed description. In the guide, we actually have Dr. Leah Alon Nichols, a rheumatologist in New York City, and she recalls that a patient told her, "It feels like my hand is stuck in a metal glove in the morning." So those types of descriptors, be it a word or a scenario, are very important. And within this feeling, it's not only how does the pain feel to you, but how are you feeling emotionally, right? So if physical pain is taking a toll on your mental health, if you feel anxious, nervous, depressed, can't sleep, your rheumatologist or your healthcare provider needs to know this. With this information, they can determine what additional treatments might be beneficial for you, including therapy or counseling or taking medication to help ease this depression or anxiety. So they could also recommend online support groups with fellow patients, those types of things. So that's very important to keep in mind. And improvement and worsen. That's also very, very important. What makes your pain worse or better? This information can be very telling to your healthcare provider or rheumatologist, as it can help them figure out whether your joint pain stems from rheumatoid arthritis or it's from something else, like what I mentioned, osteoarthritis, fibromyalgia, or others. So keep in mind these questions. Keep in mind, is pain worse in the morning? Does pain feel better with rest? Is pain better after a hot shower? Is pain worse after sitting for a long time? Is pain constant, or does it ease for periods? Is the area painful to the touch? Does pain occur during specific activities, like if you're standing from a seated position or if you're using the stairs? So those types of things are very important to keep in mind when thinking about whether the pain improves or worsens with different things, right? And finally, within this is how are your medications working for you? So with so many rheumatoid arthritis treatment options available, there's no reason to settle for something subpar. Don't hesitate to let your doctor know if you suspect your treatment plan is not working or may have stopped working. They can consider bumping it up, changing or adding something to the treatment. And while you shouldn't stop or adjust your medication dose on your own, if you have changed your medication regimen, you need to let your provider know. Skipping doses of these DMARDs, for example, could lead to painful RA flares. All right. So with all of that, I'd also like you to remember to not forget to track your RA pain with an app or writing it down. We have an app actually called Arthritis Power, and this app is a patient-centered research registry for joint, bone, and inflammatory skin conditions. You can select different health assessments that matter to you and choose how often you want to take them. When you have an upcoming doctor's appointment, you can discuss your latest assessments and feel more informed. It's important that your doctor knows how your RA is impacting your everyday life. And unfortunately, RA symptoms can come and go. So you may feel fine this week, but you might have felt poorly last week. And making sure that you're tracking this through an app like Arthritis Power or even writing it down on a diary will really help you track your RA over time and really have these effective conversations with your rheumatologist or with your healthcare provider. So when you sign up for Arthritis Power, you can select different health assessments such as pain and fatigue, and it's up to you to determine how often you want to take these assessments, if let's say weekly or monthly. And when you have your next doctor's appointment, you can discuss your latest assessment results with your doctor. And also, by joining Arthritis Power, you'll be able to contribute to important arthritis research, and just keep in mind that your data will be de-identified, and the studies will help improve care for all people living with arthritis. And with that, I'd like to thank you for being part of this webinar, and we'd like to invite you to visit us at awareness.creakyjoints.org/RA-pain, also arthritispower.org, and CreakyJoints.org. We'd like to thank the generous support of Sanofi Genzyme, who made this webinar possible. Until next time, bye-bye.